Good day, ma'am, and to each and everyone. So my name is Eliza Ferris from BSN 1A of Iloilo Doctors College. And for today, I'm going to perform a turn demonstration in assessing of head and face. So prior to performing this procedure, we need to, of course, perform hand hygiene or hand washing and don our PPE if there's necessary. So I have here an alcohol that serves as my sanitizer. So it is also important for us to prepare all the equipments needed for the assessment. And after this, we are going to proceed with the assessment proper. Hi there, ma'am. Good day. How are you doing?
I'm fine. How about you, ma'am?
Okay, that's great to hear. I'm doing good. Thanks for asking, though. So by the way, ma'am, allow me to introduce myself. My name is Eliza Ferris, and I'm your student nurse for today. So can you please confirm to me your name as well as your date of birth, please?
Fe Parcon Cofreros, November 6, 1971.
Alright. So thank you for that, ma'am. So what would you like me to call you? Is it by your first name or last name?
First name, please.
Alright. So thank you for that, ma'am, Fe. So the first thing that we're going to do is to identify our patient. So this is to ensure that we have the right patient in front of us. And it is vital to establish rapport and introduce ourselves towards our patient. So if there are any curtains or doors within the area, we need to close it in order for us to provide privacy to our patient. So the next thing that I'm going to do is to position my patient in a comfortable one and to explain the procedure. Alright, so ma'am, are you in your comfortable position? Okay, so let me help you a little bit here. Alright, okay.
Thank you.
Alright, you're welcome. So, by the way, ma'am, I'm here to perform the assessment of your head as well as your face. So, this is, why do you have to do this? So, this is to ensure that everything is normal. So, if there is any abnormalities that occur, example for in your head, if there is, in terms of its size, we call it acromegaly or the microcephalic. And in your face, if there's any occurrence of skin lesions or any signs of Bell's palsy, so we need to take note of that in order to prevent further complications. So do you have any questions with that, ma'am, or any clarification?
No, ma'am.
Alright, so far you've understood it. Okay, so don't worry, ma'am, if you do have any questions with that all throughout the assessment, you do have the freedom to do so, okay?
Okay.
Alright, so thank you for that, ma'am. So the next thing that we're going to do is to remove our patient's clothes and replace it by examination gown. So I have here the laboratory gown that serves as my alternative for the examination gown. Alright, so ma'am, let me help you with this. Okay, so it is important for us to expose only the parts that we are going to assess. Alright, so the next thing that we're going to do is to proceed with the first procedure that we're going to do, which is what we call the inspection. So what are we going to inspect? So we are going to inspect first the head of our patient. So this includes the size, shape, and configurations. So our head size and shape vary especially in accord with ethnicity. So usually our head is symmetric, round, erect, and in midline, and appropriate to the size of our body, so which we call it in normal cephalic. So I'm going to assess now my patient. Okay, so ma'am, I'm going to look at here on your head. All right, so as I'm assessing my patient's head, her head is appropriate to the size of her body, which is normal, and that is good. So the next thing that I'm going to inspect is the facial symmetry, facial features, facial expression, as well as the skin coloration. Alright, so ma'am, so I'm looking here, looking at the eyes, eyebrows, nose, labial folds, sides of the mouth, as well as the ears. They're all symmetrical, and that is good. So if we can observe if the one side of the face was drooping, or occur a numbness or weakness, we are going to take note of it because it may indicate a possibly stroke or a problem on cranial nerve number 7. Right, so far as I'm assessing my patient, everything is normal, and that is good. So the next thing that I'm going to inspect is if there is any swelling or skin lesions that occur in the face of our patient. Alright, so as I'm assessing here, so looking here at the parotid gland here on the side of the cheek, so there are no signs of swelling, and here up in the projection of salivary gland, so there are no swelling or skin lesions, and in the base of the neck of our patient where the thyroid gland is located, so there are no swelling or any occurrence of skin lesions, and that is good. So if there is an occurrence of swelling or skin lesion, you may take note of them. So the next thing that I'm going to inspect is the skin color of my patient. Alright, so as far as I'm inspecting the skin color of my patient, she has a light to deep brown color, which indicates that that is a normal color, and that is good. Alright, so the next thing that I'm going to do is to inspect the consistency, distribution, and the hair color of our patient. Alright, so I'm going to touch your hair, ma'am, and I'm going to inspect here, okay? So I'm inspecting the hair of my patient, so I'm going to remove here your ponytail, okay? For a while. So as I'm inspecting my patient's hair, there are no occurrence of skin lesions or skin breakdowns, and the distribution of hair strands are in normal, so there are no occurrence of round baldness, which we call it alopecia. So the next thing that we're going to inspect here is the color of the hair. So as I'm assessing, there's an occurrence of white color on her hair, which indicates the signs of becoming old, so we need to take note of that. Okay, so thank you for that, Ma'am Fe.
Welcome.
Alright. So the next thing that we are done with the first procedure. So the next procedure that we're going to do is the palpation. So what are we going to palpate? So we are going to palpate first the head of our patient. Right. Okay, ma'am. I'm going to put my hand here and palpate. Yeah. So looking here, if there is any bump, lumps, any perfusion, or anything hurting here, ma'am? Do you feel any pain?
No.
Alright, so by checking, I'm also here. You will experience a little massage in here.
Yeah.
So is it good, right?
Yeah, I like it.
Alright, so far there are no abnormalities that occurs on the head of our patient, and everything normal. That is good. So the next thing that we're going to inspect is the temporal artery of our patient. So with the use of our hands or 3 fingers, we are going to palpate it in a circular manner to check if there is anything hurt for our patient. Okay, ma'am, I'm going to palpate here. Do you feel any hurt in here? Any numbness?
No, mom.
Alright, okay. Alright, so there are no abnormalities that occur as we palpate the temporal artery of our patient. So the next thing that we're going to palpate is what we call the temporomandibular joint, which is located here at our side of our cheek. So in here, we are going to ask our patient to open her mouth and close it as well in order for us to check if there is clicking, if there's a crepitus or any pain in here. Right? So ma'am, I will going to put it here in your cheek here, okay? So I would like you to open your mouth, please, for me. All right, close it. Again, open your mouth, ma'am. Then close. So far, there are no clickings or any abnormalities that occur. Do you feel any hurt right here, ma'am?
No, mom.
All right. So everything is normal, and that is good. So the next thing that we're going to do is we are going to proceed with the next procedure, which is what we call the auscultation. So in auscultation, we will be needing a stethoscope. So what are we going to auscultate? So we are going to auscultate the bilateral temporal artery of our patient. Right, so just a minute, ma'am. Can you please, all right. Okay. Alright, so as I'm auscultating or assessing the bilateral temporal artery of our patient, so there are no abnormal sound that occurs, which indicate that is normal. So the next thing that I'm going to do is to check for the cranial nerves. So in this assessment of the head and face, we are going to check only the cranial nerve number 5 and cranial nerve number 7. So first we are going to test with the cranial nerve number 5. So in checking for the cranial nerve number 5 are what we call the trigeminal nerve. So there are 3 divisions that we need to remember. We have the ophthalmic division, which innervates the skin of our forehead. And the next is we have the maxilla division, which innervates the skin of our cheek or in the center of our face. And the last one is the mandibular division, which innervates the lower part of our the skin of the lower part of our face. So we are going to test it with the use of a cotton ball and something sharp or object. So in here I'm using a cotton buds that is being cut at the center of it to have a sharp texture. So I'm going to ask my patient to close her eyes and tell me if she feels the sharp or dull sensation. Alright, so ma'am, can you please close your eyes for me? And you're going to tell me, ma'am, if you feel a dullness or sharp object, okay? With the use of this object.
Yes, ma'am.
Alright, so close your eyes for me, please.
Dullness. Dull. Sharp. 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 Dull. Sharp. Sharp.
Okay, can you please open your eyes for me? Alright, thank you for that. So far, our patient feel all the things that we tested earlier to her, okay? So the next thing that we're going to check is the corneal reflex. So in here we need a cotton bud that is being twirled at the end of it. And this cotton ball will be using to touch the cornea of the eyes of our patient. Okay, so I'm going to depress the eyelid of my patient and apply this cotton ball and touch this the cornea of our patient using this to check for if both eyes are blinking. Alright, do you feel that cotton ball, ma'am, in your eyes?
Yes, ma'am.
Alright, so that indicates normal if the both eyes are blinking together. And if there is abnormalities in blinking eyes, in the blinking of the eyes of our patient, so we need to take note of that. Okay, so thank you for that, ma'am Fe. So the next thing that we're going to test is the cranial nerve number 7, which we call the facial nerve. So in here we are going to test the muscle of the muscle at the upper part of our face, which is we test it by asking our patient to raise her eyebrows if there's an occurrence of wrinkles. Right, so ma'am, can you please raise your eyebrows for me? Alright, down. Okay, so as I'm assessing my patient's cranial nerve number 7, she has an occurrence of wrinkles, so we need to take note of them. And the next thing that we're going to check is the muscle at the lower part of the face. So we have here, okay, so ma'am Fe, can you please smile for me? Okay, alright, so show up, can you please show me your teeth? Alright, so far there are no abnormal movement or any twitching that my patient doesn't control, okay? So everything is normal and that is good. So the next thing that we're going to do is to wash our hands, because that ends our assessment. Okay. So I'm going to wash my hands. Okay, alright. So the next thing that we're going to do is to wash our hands because that ends our assessment. Okay. So the next thing that we're going to do is to wash our hands because that ends our assessment. Okay. So And after, we're going to wash our hands or sanitize our hand. We are going to document all the findings and all the results that we found all throughout the assessment. So thank you, ma'am, for your time, and you do have a great day, okay?
Thank you. Welcome, Mom.